As the owner of a home healthcare agency, it's crucial that your employees understand Oasis and how to use it. Otherwise, the health of your patients and the financial security of your agency are at risk. You should know that Oasis is an assessment tool and not a questionnaire or a checklist. Oasis stands for Outcome and Assessment Information Set. It helps you methodically and accurately document each patient's condition to develop a customized care plan. Registered nurses, physical therapists, occupational therapists, and speech-language pathologists can perform Oasis assessments. After treatment, you create an Oasis discharge comparing how the patient's condition has changed. Medicare and Medicaid require Oasis to verify patients are getting the best possible care. They can reduce the reimbursement rate of home health agencies not adhering to Oasis reporting requirements. Explain to your employees that Oasis is a full body assessment. For example, you must look at the patient's skin, including the elbows, heels, and buttocks, checking for areas prone to breakdown. Here's the kicker. When you don't do an accurate full body assessment, you are underscoring the assessment, and that means money lost. If you don't assess properly for skin integrity, the patient could succumb to sepsis. So nurses will document providing elbow pads, heel pads, and donuts to sit on. They may set a timer for the patient to stand up for 5 minutes every hour to improve the blood supply and avoid developing a Decubitus ulcer. You're also looking at the patient's medications. As you ask them what a prescription is for, to verify they understand their treatment plan, you will also observe things such as how well they walk or stay balanced. Diplomacy may be required. A nurse doing an Oasis should ask a woman who has had multiple children whether she is incontinent. The patient may be too embarrassed to answer truthfully, but the nurse notices a box of incontinence pads in the bathroom and says, "I see you're wearing Depends. Is that a constant problem or just intermittent?" Now, the nurse can recommend a therapist to work with the patient on exercises to minimize episodes of incontinence, and describe this progress with Oasis to demonstrate improvement. We've seen agencies losing $600 to $800 per assessment per episode of care, which leads to more than $200,000 lost in a year because of inaccurate Oasis assessments. The Oasis experts at Kenyon HomeCare Consulting have years of experience training home healthcare agency workers to use the Outcome and Assessment Information Set tool. It typically takes about 2 months to learn Oasis, with 1 hour per week of training. To request Oasis training for your team, call us today at 206-721-5091 or visit the Kenyon HomeCare Consulting website at www.kenyonhcc.com.